Good morning. This is Sanya, Student Hospital Unit Clerk, Student ID 398845. Today I am going to present cystoscopy. So, cystoscopy. Before starting this presentation, here is a little introduction about the diagnostic imaging test. So, these are the tests which are used to examine the soft and bony body tissues. These are the tests which are conducted in the radiology area of the healthcare facility. Due to increased trend of the computerized technology, the images are stored in the computer for later reviewing on the monitors. So first of all, the cystoscopy is the procedure which is used for diagnosing as well as investigating. This is used for investigating the situations like pelvic pain and overreactive bladder and frequent urinary infections. Whereas the diagnosing of conditions like blockages, enlarged prostate glands, non-cancerous growths, and problems with ureters are diagnosed with the cystoscopy. So the test of cystoscopy is done with a whole procedure, but prior to the procedure of cystoscopy, the patient is need to urinate to make the bladder empty, and after getting the empty bladder, the patient get dressed properly for the surgery in the surgery gown and then lie down on the treatment table. This will also help the patient to get the better treatment if the position of feet of the patients are in the stirrup position, and the patient will get some antibiotics for preventing the bladder infection, and this point will get the patient to the stage where he will get anesthesia. If the anesthesia is general, then it will be okay that the patient is conscious of until he or she wake up. But if the anesthesia is local or regional, then it will be accompanied by some sedatives to relax the patient. And then an anesthetic gel or spray is used to lubricate the scope also by the doctor. And the same gel or anesthesia is used to numb the urethra. So some sensation will still occur, but the procedure will be less painful for the patient. So the doctor will lubricate before inserting the scope into the urethra. This will cause a slightly burning sensation, but it feel like urinating. So for an investigatory procedure, the scope is thinner and flexible, whereas the slightly rigid and thicker scope is used for the surgery and biopsies. The surgical instruments are passed into the body through the bigger size of the scope. The doctor will investigate the bladder through a lens of the scope. The bladder will be flooded with a sterile solution to make it easier for the doctor to look into the bladder, that what's going on in there. So sometimes the fluid bring uncomfortable condition for the patients, and it feels like need to urinate. With the local anesthesia, the cystoscopy takes only less than 5 minutes. But if it's sedatives or regional anesthesia, then it will take up to 15 to 30 minutes approximately. So radiology is the department where this type of tests are carried out. So the radiology department is also further divided into other categories like CT scan and MRIs, etc. So according to the job description of the HUC, the HUC need to fulfill the requisition form and place the transportation and placing the preparation card for diagnostic imaging in the chart of the client. So requisition form can be fulfilled with the help of SCM, and the porters are booked from the hospital portering system. HUC has a very important role in providing the best treatment for the patients. So this is all about. Thank you.